The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. It's hard to believe, but we're celebrating our 10th anniversary of Health Matters radio program. We're planning some special shows to celebrate the milestone, so we hope you will stay tuned. Let's begin today by thanking our sponsors, Cleveland Clinic Mercy Hospital, Studio Arts and Glass, and of course our socially distant technical producer, J.D. DeAngelis. Joining me is Brad White, a compounding pharmacist, and our very special guest, Barbara Fristacci, RN, Administrative Director, Ambulatory Services and Employee Health at Cleveland Clinic Mercy Hospital. Good morning and welcome to the show.
Good morning, and thank you for having me back.
This is your second time or third, isn't it?
I think it is my third, yes.
Okay, all right. Good to have you.
Thank you. It's good to be here.
All right. Well, you can't open the newspaper without hearing about the rising cost of healthcare, and it's a concern that we all share. Deductibles and copays continue to rise, and many of us struggle to manage medical expenses within our household budget. Consider the cost savings of visiting the urgent care center, like Cleveland Clinic Mercy Hospital's urgent care, compared to the visit to the emergency room. Studies show the average cost to visit the urgent care center is $150 compared to almost $2,000 at the emergency room.
Jeez.
Today we're going to be discussing the benefits of urgent care clinics and when to consider using an urgent care clinic. We'd like to remind our listeners that our program is available on our podcast. So just look into the App Store on your mobile phone for Health Matters with the Medicine Center Pharmacy, and you can subscribe to any of our programs. If you've got questions you'd like addressed, post them up on our live Facebook feed, and we'll try to touch on them during the program.
So, Barbara, welcome back to the show again, third time around. Please introduce yourself again and tell our listeners a little bit about your role at the Cleveland Clinic Mercy Medical Center.
Hey. Again, I'm Barbara Fristacci. I am a registered nurse. I am the administrative director of our ambulatory services, and I oversee our urgent cares, occupational medicine, or work health safety program that people might be familiar with, and our employee health.
So I think the last time we spoke, we were in the beginning of the pandemic, and you explained that Cleveland Clinic Mercy Hospital was doing what they were doing to keep patients safe and how services might be different than patients are accustomed to. Can you give us an update and tell us how things are going?
Well, things are going very well at the hospital and in our outpatient centers. We are operating at full speed. We are still providing safety for our caregivers and our patients that are using our services. Masks are still required by our staff as well as patients and visitors that are coming into our health centers or into the hospital. So we do still check patients that are family members that are coming in to visit. We're checking temperatures, we're asking questions, and then we're asking them to wear a mask.
So I suspect that many of the pandemic changes like telemedicine is here to stay. Is that correct?
I think that, telemedicine will probably be here to stay, and I think it's been a wonderful tool for our caregivers to utilize when their office visits were not an appropriate setting for patients to come in, whether they're symptomatic or the patients just did not want to come out. So this did provide availability for our physicians, our caregivers, to see their patients and to treat them. It is, one of the best tools, I think, that we had through the pandemic, and I believe that it will continue to evolve and will get better.
So it appears that we have a lot more urgent care centers available for the public now than we used to. Why is that?
Well, urgent care centers across the United States have increased, and that's because patients are looking for affordability as well as accessibility and convenience. It is less than an ER visit and slightly more than an office visit. Hours are longer than primary care, and they are open 7 days a week, in which primary care offices are not. So it's better to go to an urgent care versus an emergency room when it's appropriate.
All right. So how many off-site locations does Cleveland Clinic Mercy Medical Center have around our community, and where are they located?
We have 18-plus facilities across the county. They are located in Alliance, Louisville, Canton, North Canton, Massillon, Jackson Township, Plain Township, Hartville, Lake, Carrollton, New Philadelphia, the Belden Village area. And I think did I say Plain? In Plain Township?
You did, yep.
Quite a few, very, very, in all three counties. So.
Amazing.
So do all those locations have an urgent care center?
No, not all of them have urgent care. The urgent care centers are located at our Massillon facility on Lincoln Way, in Jackson Township on Wales Road, in North Canton on Whipple Avenue, at the Plain location in the Oakwood Square plaza that's ever growing. Then we have one down in New Philadelphia on High Street and one in Carrollton on Canton Road. Those are where our urgent care health centers are located.
I have to imagine that really increases access for patients and takes a burden off of travel time if you need an urgent situation. The New England Health Institute has said as many as 56% of ER visits were totally avoidable, and it's one of the many reasons Americans spend over $3 trillion in healthcare expenses a year. Can you talk to our listeners about the difference between an urgent care center and an emergency department?
I can. I think the difference between the emergency room and urgent care is right there in the name of the department. An emergency department is for emergencies, meaning a life-threatening and limb-threatening injury or illness that if it's not attended to, there's a high probability there could be death. An urgent care is a medical clinic with expanded hours and medical providers that can treat a broad spectrum of minor illnesses and injuries. So the difference is it an emergency where it's life-threatening, or is it just a minor injury that can be addressed by another caregiver? I think those are the two different, that's the biggest difference in the two.
So what about urgent care centers? What type of injuries can be treated there?
Well, minor burns, cuts. We can do laceration repairs. In terms of injuries, we've seen sprains and strains. We've seen some you have a broken finger, you have a broken toe, you have a minor, you don't know if you have something broken. It's not that bad. You can come get an x-ray. We can identify that, put in a cast, make you a referral to an orthopod. So those are the injuries that we see. Bee stings, insect bites, poison ivy rashes, those kinds of injuries are what we see in an urgent care.
So what symptoms and concerns would send you or should send you right to the ER?
Well, if you're having any cardiac issues, if you're having chest pain, shortness of breath, the classic symptoms for a heart attack, you need to go to the emergency room. If you are having stroke-like symptoms, loss of body movement, loss of vision, inability to swallow, those kinds of things, seizures, loss of consciousness, those are the reasons that you would go to the emergency room. You've been in an accident. You have a very bad laceration. Your limb is hanging. You've lost a finger. Those are sorry.
Gosh.
Those are the reasons you would go to the emergency.
Better get that finger and put it on ice if you lost it.
Exactly.
Because I hope it could be reattached.
That's true. That's right. Exactly.
Okay.
Yeah.
So, with our listeners' busy lives, I am sure you're interested in wait time and times around the Cleveland Clinic urgent care facilities, those sort of things. I know some new electronic issues, like you can call in or you can see how long your wait would be. Am I on target there?
Well, it's difficult to really give you a time frame when somebody does call in. We can kind of give you an idea, but you never know what's going to walk through the door. You can have 5 people walk through. I can tell you there's nobody waiting right now, and then 5 people walk in, and then you drive over and you go, wait a minute, there's 5 people here ahead of me. So that makes it very difficult. But we just completed our second quarter of performance improvement where we measure our throughput time, and it averages between the 6 sites to be 57 minutes. So the lowest is about 50 minutes. The highest this past quarter was 70 minutes, and that is from sign-in to discharge. So it's a much quicker turnaround as well in the urgent care than it is in the emergency room.
Do all these locations have a physician on staff? We have physicians. Sometimes we have our licensed nurse practitioners, but we do have licensed board-certified family practitioners. We have board-certified nurse practitioners and licensed physician assistants that work. Many times we have a physician and a mid-level provider. And overnight in like an emergency room, okay? Mm-hmm. And is there always a physician there too, or not?
Overnight in the emergency?
Yeah, like let's say at 4 o'clock in the morning.
There's always physicians, yes, in the emergency room, yes. Mm-hmm.
Okay.
Yes.
All right. What other services are offered at the Cleveland Clinic Mercy's off-site health centers?
Well, we have an array of services, and it depends on the site that you're going to, but they all have diagnostic services, so MRI, CT, mammography, ultrasound, bone density. All of them have primary care offices. Some have sleep. One has a sleep center. We have cardiac services, and therapy is predominant in a lot of our health centers.
Interesting. Okay.
Mm-hmm.
Okay, probably time to take our first break. You're listening to Health Matters at the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you ready for a change? Transfer your prescriptions to the Medicine Center Pharmacy. Hi, this is Paul White from the Medicine Center Pharmacies. Are you looking for the personal touch from your pharmacist and pharmacy staff? Do you need home delivery or custom packaging to simplify a complex medication schedule? Look no further than the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Bring in your prescription bottles, and we can transfer your prescriptions to the Medicine Center today, where wellness begins.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patients' safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Hundreds of new items have arrived at the Half Off and Out By store in Louisville. How about over 700 watches to choose from? All readers and sunglasses are reduced to $1.69 each. Values to $20 and above. And lots of new toys, Lasco box fans, Utz chips, coffee K-cups, 4 for 99 cents, and many varieties. The Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy, and see us on Facebook. We continue our 4th of July super sale of 20 to 50% off most merchandise. Everyone has been tuned in to where to get their COVID vaccine. We've been proud to serve the community in this process. The Medicine Center offers many other vaccines like shingles, influenza, pneumonia, Tdap, meningitis, MMR, hepatitis A and B, and travel vaccines. Do you need a vaccine? Give us a call at the pharmacy or visit our website at medshoprx.com to schedule your appointment. Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are with Barbara Fristacci, RN Administrative Director, Ambulatory Services and Employee Health at Cleveland Clinic Mercy Hospital. That is not on your name tag, is it? All that? Okay. All right.
All right, Barb, you mentioned that that you have laboratory and radiology services at these off-site care centers. Do all the Cleveland Clinic Mercy Health Centers offer full blood and radiology services?
Yeah, at our urgent cares, we do, yes. Mm-hmm. And at the health centers, yes. Mm-hmm.
Okay.
And other sites, we have a draw station at Louisville, so they do testing there as well.
Okay.
Okay. We understand that all of the Cleveland Clinic Mercy Urgent Care Center locations now offer express check-in. Mm-hmm. So how do I make this work for me, and where can listeners go to utilize express check-in?
Our express check-in has been very helpful for a lot of our patients. So how you can do it is you can go to cantonmercy.org and you scroll down and you will see Stack Care Save Your Spot, and you click on that. So when you do that, all of our 6 centers open up, and it says there's a little button that'll say Save Your Spot. So depending on if you're in Carrollton, you would go to the Carrollton, or if you're in North Canton, you go to North Canton, and you click on that, and there's going to be some times that are available for you to choose to save your spot. And what you do is basically you're saving some time, like you're saving yourself your spot in line. And you put in your name, you put in the reason for you coming to the visit, and you do your waiting at home. So you don't have to wait in the waiting room, and you come maybe 10 minutes before your time that you registered for. So it's a kind of save your spot, save yourself in line.
I know that the hours of these urgent care centers is not consistent with the emergency room. What are the hours?
Our hours vary. So our North Canton site is open 8 to 9 Sunday through Saturday, so every day. Jackson is 8 to 9 Monday through Friday, 9 to 5 on Saturday and Sunday. And all other ones, Massillon, Plain, Carrollton, and Tusk, are 8 to 8 Monday through Friday and 9 to 5 on Saturday. And the emergency room is open 24/7. So that's the difference. But our hours are extended in the evening time.
Okay. So in the summer months and in the time when athletics are really, up and going and teams are playing and all that kind of stuff, what's the situation as to, okay, now, I'm a dad or I'm a mom and my kid's going to get the best care, so I'm going to the emergency room for a split finger or something. So do we see this? Do you see this?
We see athletes that come into our urgent cares for minor injuries, yes. And they can use the urgent care for that. Going to the emergency room for something like that is going to be costly, and it's also going to be, their wait time is going to be a lot greater because you do have other patients that are there that are going to require the time or need to be seen first.
Okay, so summertime issues are probably different than wintertime issues because you've got all this poison ivy and bug bites and bike accidents and all this kind of stuff. So what do you recommend the listeners to keep on hand for like poison ivy, bug bite, sunburn, all that sort of thing?
Well, that's something that we get a lot at the pharmacy for questions, and I think the best thing you can do is think about it in terms of 3 things. You need to have something for first aid. You need a first aid kit would be ideal. You also need something for maybe colds and flu symptoms, and you also need something for pain. So, whether it be just some Tylenol or Motrin for bumps and bruises, you certainly want some Band-Aids and some antiseptic cleansers for cuts and scrapes. And, you never know when it's going to be the middle of the night and you've got sinus drainage or a cough or some congestion. So you always want to have just those basics on hand. Mm-hmm. So those are some things that we'd recommend from the pharmacy point of view. All right, Barbara. So we mentioned earlier that visiting an urgent care is much more affordable than visiting the ER. But could it be more than the cost of visiting your primary care physician? And why is that?
It can be. Yes, it can be. Because depending on what the person is coming in for, we may do additional testing that would not be done, per se, in a primary care office. So we might do a chest x-ray. We might do an EKG. We might have to do, some lab work, a urine. And so all of those kinds of things add up and become more expensive for an individual. Yes.
Yeah, Barbara, I'm thinking that you've been at the hospital for a really long time. And I guess I'm wondering, do you think people now, as opposed to a few years back, don't really know how to take care of minor issues and things like that, and they have a tendency to either jump to the emergency room or jump to one of these care centers? Go ahead and you can you can answer this truly.
I don't know that it's that people don't know how to handle it. I think people worry today, worry about infections, worry about, they've heard one person that had something that happened to them, and if because they didn't do one certain thing, it turned into something greater. So I think sometimes people become very anxious, and they seek out professional care. So I wouldn't say that they don't know. I know years ago people did a lot more, self-remedy, home remedies. Grandmothers told you to do something. My grandmother always told me to do things, and I still do those things to this day. In addition to,
you mean like mud on a bug bite, or mud on a
Sure. Exactly. Yeah. Those kinds of things. So, or, chamomile tea for an upset stomach or something like that. It just trying those different things, and whether or not people, want to do something like that, or they want to seek professional guidance right away to nip it in the bud or take care of it. It's a personal decision. I would not want to say that the public doesn't know how to take care of themselves. I just think they want to care.
Okay. All right. It's the bottom of the hour, time for the news. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back, folks. You're listening to Health Matters with the Medicine Center Pharmacy. Just a quick reminder that our Canton store has Moderna COVID vaccine available for immunization, and so this morning we've got a lot more to cover, and I want to go back to self-treatment, okay? In my career as a pharmacist, I've heard Vicks Vapor Rub used for everything and dosed in many other ways, okay? Like put it on your chest, cover your nose with a towel or a diaper or whatever you got laying around the house. Take a teaspoonful of it, put it on, I know, because it's all Vaseline, it's all petrol. Put it on the bottom of your feet, it works better there. Under your arms, it works better there. So, tell me some stories that you've heard about Vicks.
I've heard the same thing. I've heard put it on the bottom of your feet. I heard it takes off skin tags. I mean, I've never tried
I haven't heard that one. Okay.
Yeah, I've heard skin tags. I've heard people put it on their chest and put a cloth on it, and it helps with breathing, when they're congested.
Yeah.
Yeah. Vicks is used a lot.
I'm alive today because of Vicks, I think. Because of all the remedies my mother used.
Put it in a pot of boiling water and then put a towel over your head.
Yep.
Close your eyes.
That's right. I love it. Okay. I suppose many folks who use urgent care have an expectation that they're going to get an antibiotic for about everything, okay? Mm-hmm. So can you explain why antibiotics are prescribed less, even if the patient believes they need one? Right. And the patient has already looked on the internet, and then they already know what they need, okay, before they come to you.
Right. Yes, that's true. Our caregivers are very careful with antibiotics, and we prescribe to the antibiotic stewardship, meaning, we prescribe when it's appropriate. So if the provider feels that there is a bacterial infection, or they do a test and they find that the person has strep or something like that, they will prescribe an antibiotic. But if it's a viral infection, if the vital signs and the person says, this started this morning, and the vital sign, there's no fever, there's nothing going on, they're not likely to prescribe an antibiotic. Antibiotics that are overused are not good. We all know that's a problem. That's one of the reasons we have these superbugs, one of the reasons that some of these antibiotics don't work anymore. So unless it's really appropriate, it's not beneficial to take an antibiotic if it's a viral infection. And so they're very careful with that. And unfortunately, patients do come thinking that they should get an antibiotic. And our caregivers do provide a lot of education as to why they are not giving them. And then they'll say, if it continues on, see your healthcare provider, see your PCP about that, or call us back. But they are very hesitant to give an antibiotic when it's not indicated.
All right, so you bring up a really good question. With all these urgent cares available to help people with their needs, is it still important for a patient to have a primary care physician?
Well, I'm so glad you asked that question, because I believe that everybody should have a PCP, a primary care physician. Good health care is about a relationship with your doctor. So when you have a family physician or an internist, whoever you are seeing as your primary care physician, and you see them annually for your physical, they're monitoring your vital signs. They're looking at your weight. They're looking at your blood pressure. They're following you and recommending the preventative tests that you should be giving along your lifespan to prevent or identify issues that are, early on, so they can be addressed and they don't become big issues. So I think everybody should have a PCP. Absolutely. Yeah, I recommend it.
Okay. Barbara, does Cleveland Clinic Mercy Urgent Care locations, do they provide treatment for occupational or job-related injuries?
We do have a department that manages, or that does that. That's our work health safety out at the North Canton site. But if an individual has an injury at work and comes to one of our urgent cares, we certainly will address that. We do a lot of care for after hours when work health safety is closed. So yes, we will take care of those needs. Yes. Mm-hmm.
Okay. Well, let's tick through a list here. We've had some questions on our Facebook feed about. I'm just not sure when to go to the ER or the urgent care, okay? So let's go through a couple things here. What if you cut yourself and you may need stitches?
Come to the urgent care. If it's not severe, you come to the urgent care. We can take care of that.
Okay. All right. What about a broken bone or a sprain?
A sprain we can see in the urgent care. If the broken bone is a break through the skin, I would recommend you go to the emergency room. If you're not sure if it's broken, you can come to an urgent care, and we can diagnose that.
Okay. All right. What about chest pain?
Go to the emergency room, unless it's from a cough.
But how many people go to the emergency room with chest pain? I mean, you get chest pains all the time from stomach issues and bad food or good food or hot food.
A person has to. I really kind of, figure out what their chest pain is caused. I mean, if if it's chest pain that is not normal, they have sweating, they've got some tingling in their left arm, it's different than, a muscular pull. It hurts all the time, not just when they move. It could be cardiac, and I would definitely go to the emergency room.
Okay. What about a suspected urinary tract infection?
We can handle that at the urgent care.
Okay. What about maybe an animal bite or some severe insect bites, bee stings and things?
We can handle bee stings at the urgent care. If you got bit by perhaps a rabid animal, the emergency room is probably the first place to go because you will get your first dose of medication for that, and then will be followed in the urgent care. But if you have a dog bite, a cat bite, you can be seen in the urgent care.
Okay. What about a high fever?
Well, it depends on that fever. If this is a very, very high fever that's caused the person to be in and out of consciousness or somnolent, meaning they can't be aroused easily, I would probably, you take an antipyretic and it's not helping, then you probably need to be seen in the ED, in the emergency room. Yeah.
Okay. And I would guess that really goes for younger children or infants that have high fevers. You probably would want to steer that way versus...
If it's an infant and it's a high fever and they come into our urgent care, we will get them back very quickly. We will take them back because, can go down, can get sick very quickly. So we want to make sure that they're taken care of, yes. Mm-hmm.
Okay. What about symptoms of stroke?
Go to
numbness of face or,
That's an emergency room, correct.
Okay. What about flu or difficulty breathing?
Flu symptoms, we can see here. Difficulty breathing depends on how bad this difficulty breathing is. A lot of people now have pulse oximeters. So if your pulse ox is below 90, chances are you should probably be seen in the emergency room.
Okay.
I remember when they first came out, they were so expensive, but now they're just really like I got to have one because they're so inexpensive. So it's kind of a neat little device.
Yeah, I think the pandemic has certainly propelled everybody to get one of those. Although I haven't yet.
You don't have one?
Hopefully you don't need it, but you're right.
Right, yes.
You're a nurse person. You should have these things.
Yeah, you're right.
I would think, being a pharmacist and living in a neighborhood that at one time had a lot of children, you get these phone calls in the evening, hey, I need some cough syrup. You have some cough syrup, or do you have any? And it's interesting that most people just really don't have the basics, around the house. Okay, you can run down the street to an all-night whatever place, gas station, drugstore, or whatever, but it is interesting that a lot of folks just don't have the basics in their home to, treat a kid, treat themselves, or what else.
Yeah, it's good to have. I think Brad mentioned having a first aid kit. I think it's good to have one of those around. I think, but you have to check it because if you're not using the items, they do expire. So
everything goes out of date. Yeah. That's for sure. Some of the topical ointments and stuff can last forever. Mm-hmm. Even the antibiotic ointments, they have some semblance of still whatever. But the Tylenols and those other medications, man, they need to be in good date to consume the products.
Correct.
And it does seem like you never have those things that you need until it's like 1 o'clock in the morning. And I'll admit falling guilty to that. But, make sure you review those things because you never know when you need them, from a cough drop to a vaporizer. Sometimes that makes your night a whole lot nicer.
Yeah. Right.
Exactly.
Yep.
Well, we can probably think about taking our last break here.
Yeah. Okay. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
I'd like to remind our listeners that our program is available on our podcast. Use your favorite podcast app and go to the App Store and look for Health Matters with the Medicine Center Pharmacy, and we'd appreciate if you'd subscribe.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Hey, we're back, and we're talking with Barbara Fristacci from Cleveland Clinic Mercy Hospital. If you had to keep stuff, pills, whatever at home, what would be your basics? Okay. You got a couple, let's say you got a couple kids, and teenagers or younger and whatever.
Yeah. Well, what I keep, I do have Advil, I have Tylenol, I have cough drops, I do have Mucinex. We keep Benadryl on hand. I have vitamin D. We have lots of vitamins. Got Bactine, Band-Aids, gauze. What else do I keep at home? I keep antibiotic ointments in case we need those. And because I do have grandchildren, I do keep some of those, children's Motrin and children's Tylenol on hand as well. That I usually toss out because they never use it before it's.
Yeah, sure, they go out out of date. You're pretty well stocked, and you got those kinds of things I take care of. Yes, yeah. Okay, now, Grandma, do you take all the kids to McDonald's for lunch and all that kind of stuff, or
no? Don't. Actually, all my grandchildren are in Columbus, so I don't get to do that. But they're not. Their parents aren't fast foodies. So
okay, nutritional stuff. Okay, well that's cool. All right.
Yes. I have one granddaughter say to me one day, she goes, "Grandma, I haven't had my vegetable. I haven't only had 2 vegetables today."
Oh my gosh!
So
interesting.
Very good training by her mother. So they have their grains and their fruits and vegetables. So
love that. Okay.
Yes, I do.
Yeah, that's cool. All right.
Yeah.
Okay, that's off the record. Sorry.
That's okay. So, Barbara, we've been talking about responsibly using, your medical expenses and fees with using urgent cares over emergency departments when possible. And, I think that all of us, whether have sat in a meeting and learned about our healthcare benefits and realized that it's a really good idea to be responsible to choose a more cost-efficient method to get care. And we forget that prescription drugs can be sometimes one of the most expensive things that we incur. And, at the Medicine Center pharmacies, we've tried to help our patients find more cost-effective items when you all of a sudden find out that you're on a medication that costs thousands of dollars a month. We can't always help you find a solution, but sometimes we can help you find some avenues like, manufacturer coupon cards and things to try to ease that healthcare burden on you and your employer or your health plan. So I think it's important that people think about their healthcare expenses and not just assume that it doesn't matter where they go. It certainly matters to know your physician and your primary care physician, like you said, and to take advantage of that service and relationship. It also matters to know your pharmacist and make sure that you can ask questions and not be afraid or intimidated to verify something that your provider may have told you. And maybe, you were under a lot of stress when you were at the urgent care or the emergency department, but it's clearly something that you can, the more questions you ask, the better informed you can be and hopefully the better decisions you can make. So why don't we've got about 5 minutes remaining in our program. I think it'd be a good idea for listeners just joining us if you kind of gave a nice summary of what we talked about today with respect to making sure that you don't hit the ER and get frustrated with a big bill and how to maybe segment your choices when you're in the stress of a moment where you're really concerned about an injury you may have had.
Okay, I guess I would say when you are considering whether or not to go to the emergency room or to the urgent care or to call your PCP, number one, your PCP may not be available. It may be after hours. It might be a weekend. So then the question becomes, is this condition that I have, this illness or injury, is it life-threatening? Is it limb-threatening? If it is not, then an urgent care might be your best bet. If it is something that, if I don't get this addressed, like I'm having chest pain and shortness of breath and I'm sweating and I don't know what this is, I never had it, I'm not going to take a chance and go to an urgent care. I'm going to go to the emergency room, or I'm going to call 911. So I think that's how people should consider it. If it's something that, you don't have a high fever, you feel okay, you just don't feel great, you may be able to wait and talk to your PCP about that. Or if you call them and sometimes the appointment is way, weeks away and you feel terrible now, you may want to go see an urgent care and see a provider there.
Okay.
Interesting.
How about a roll call on where your urgent cares for Cleveland Clinic Mercy Hospital are located, and maybe touch on your website and how people can find those addresses and do your express check-in?
Right. Well, you can always go to cantonmercy.org, and if you click on locations, all of our health centers will come up. So depending on where you are, you click on the one that is closest to you, and it will come up, and it'll have the address, it'll have our times in there. It will also have the ability. You'll see an ability to do a express check-in. So you can do that through cantonmercy.org. Otherwise, our sites are located. We have 4 sites in Stark County. We're located in Oakwood Square, our Plain Health Center, Stack Care, on Whipple Avenue in North Canton, on Wales Road in Jackson Township, and on Lincoln Way in Massillon over the viaduct. We also have our Stack Care. If you live in Tuscarawas County, we're in New Philadelphia on High Street. And if you are living in Carrollton, we're on Canton Road in Carroll County, in Carrollton.
Very good.
Is your office in the hospital or?
No, my office is actually out here in Jackson Township.
Oh, no kidding.
Located on our Jackson Health Center. Mm-hmm.
Okay. I'm going to try and get out there in the next day or so, and I'll leave a pulse oximeter at the front desk for you. Would that be okay?
Oh, that would be very nice, but you do not have to do that.
All right, no promise today, okay?
No.
But in the next couple of days, so just check down there, okay?
I'm bad, huh? I don't have my pulse oximeter. Oh,
hey,
shame on me.
as you said, it's a wonderful toy. I check mine every night.
Do you really? Oh, yeah.
Just because it's a toy, I guess. I don't know. I've been as high as 98 and as low as 96 or something like that, I guess.
Yeah.
So anyway, but I'll get you one.
No.
We need to take care of our healthcare professionals here too,
I just haven't thought to get one. I guess maybe you haven't needed it, but that's always when you need it. Though, it's when you really need it.
You don't have it. I gotcha. So anyway, that's what I'm going to do. Okay, I'll have them call you. Okay.
Okay.
and tell you it's the desk. All right.
Thank you.
Okay. I don't know where we're at time-wise. How are we doing?
We got about 2 minutes, so we can. Okay. I appreciate your message today, and I think it's important for all of us to be mindful of our health care. Sometimes it's very difficult to afford. We get a lot of patients that come in the pharmacy when they ask us to check their blood pressure or do something, and they don't have a primary care physician. So I think that was an important message you also had. We think it's important for you to have a relationship with your pharmacist and also with your primary care physician, but to be aware in the community that the urgent cares are there for needs that aren't life-threatening, but the emergency departments are there to take care of you when you're most in need, but it's probably just going to cost a little more. Right. But that's because there's higher skilled care there, right?
That's right. That's right, exactly. And just to add to that, Brad, if anybody is around our urgent cares, we do check people's blood pressure. So if you want to come and stop in, have a blood pressure check, we will also do that. There's no charge for that.
Okay, that's interesting.
Yeah. Mm-hmm.
All right. Well, I suspect we're about out of time then, right?
Yep.
Okay. Thank you very much, Barb, for showing up today and helping us out, okay?
Well, thank you very much. Enjoy being with you both.
Barb Frastaschi, RN Administrative Director of Ambulatory Services and Employee Health at Mercy Cleveland Clinic Mercy Hospital. We would like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. And thanks to our sponsors, Mercy Medical Center, Cleveland Clinic, Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. We see you right here next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy.